Welcome to the UWCFD's Food Distribution Lunch and Learn, everybody. It is now 12:05, and I will get us rolling on Lunch and Learn. I'm pleased to welcome all of you. I believe we have Northwest Harvest, UW Food Pantry, City Fruit, and Lifelong with us today. So first up is Carmen with the Northwest Harvest. Carmen, take it away.
Thank you. And I'm going to share my screen. And here we go. Great. Can you guys see that? Not quite sure, actually. Oh. Can you guys see that now?
Yes.
Sorry, great, perfect. So my name is Carmen Mendez. I am the Director of Hunger Response Network and Distribution for Northwest Harvest at a statewide level. I've been with the organization for about 19 months now, and I started doing procurement and sourcing for the organization, and then I moved to Senior Manager, now Director. This presentation will consist of what we're doing at Northwest Harvest in terms of distribution partnerships, but also really addressing some of the overall organizational goals, like our mission, vision, strategy, and then a little bit about what we've been doing during this pandemic. So our mission, vision, the mission of Northwest Harvest is leading the fight for hungry people statewide to have access to nutritious food while respecting their dignity and promoting good health. Our vision is ending hunger in Washington. Our hope is that that we will cut hunger by 50% in 2028. And so we know that a lot of what needs to happen is upstream. So we also have an advocacy team and other departments that are helping us end hunger, not just through food pantries and distributing food, but also figuring out what policy issues need to change in order for that to happen. So as an organization, we have 5 overall strategies. Those are to distribute food to alleviate food insecurity, center BIPOC experiences to build a more just and equitable emergency food system in Washington, achieve the right to food in Washington, support BIPOC supply chain market actors to secure more resources within Washington, mainstream the narrative that hunger results from unjust systems, not individual choices. And so these are 5 strategies that different teams, different departments are working on. The one that my team, which is Hunger Response and Distribution, is working on specifically is to center BIPOC experience to build a more just and equitable emergency food system in Washington. And so what does that mean for Northwest Harvest? We know that there are very many different BIPOC experiences, and that not one experience dictates how we're doing our distribution or how we're approaching our work. And so some of our strategies within this, or some of our goals within this strategy is to hire a tribal specialist that would help us reach tribal communities and really learn how to best serve those communities. We're currently going through the process of evaluating our partners to make sure that they are aligning with our mission and vision, that they are an anti-racist organization, that they don't require forms of identification when folks go to their food banks or pantries to access our food, and also creating a fast track for BIPOC organizations that typically have not been in the business of distributing food. And so what does that mean? For us, it means that we'll onboard them and then work with them to be able to figure out how we can best provide resources to them. And a lot of this has been happening with non-traditional organizations that have started distributing food during the pandemic. So a lot of churches, but also just other folks who have come together that know their community better than we do. And so we're supporting them by providing them access to our inventory and helping them with other capacity opportunities. And so on the distribution side of our department, we distribute about 2 million meals per month. That includes our Kent, Yakima, and Spokane distribution centers, our Soto Community Market, which is the free grocery store located in Soto, our Harvest Pantry, which is a program for non-Northwest Harvest partners who can come and access this pantry twice a week if they wanted to. The Harvest Pantry program is open twice a week on Wednesday and Thursdays in all 3 locations. And basically, this is an opportunity for smaller pantries to come and shop and take what they need. And we don't require them. The only requirement is that they have a 501c3 or that they have a fiscal sponsor. Our 3 Square programs is an after or a weekend lunch program for children. And so we partner with 42 schools throughout the state, and we provide prepackaged meals for Friday, Saturday, and Sunday. And then we have a partnership with Inaba Produce out of Wapato. They are a 3rd generation Japanese American farming company. They've been working in the Yakima tribal, we have a very small office, so I'm just hearing people. So they are working, they were one of the only families that were allowed to lease land from the Yakima Reservation over 100 years ago. And so it's been really important for us to be able to invest back in BIPOC small farming businesses. And so this is one of the organizations that we partner with. And the emergency response during COVID-19, what that looked like for us, it was that we went into a agreement with WSDA, Washington State Department of Agriculture. The state was then divided into 3 parts. Food Lifeline was distributing on the west side, the 13 most west side counties. We were distributing kind of like very middle of the state, and Second Harvest was taking care of the other area. And so what that meant was that we had to stop delivering statewide during this emergency response, that we had to be more nimble, but also figure out how to best work with the other 2 statewide agencies to better coordinate and not over, we don't have a push model. So we want to be able to give pantries and food banks what they need, and not what we have and what we want to get rid of. Like I mentioned, we have partnerships. We have about 375 partners. We're currently going through that evaluation, and our hope is to be able to go through these partners and identify who align with us, who doesn't align, and if there's opportunity to work with them to be able to guide them through our journey alongside with us. And so these partners consist of food banks, food pantries, school meal programs, nonprofit organizations, and community-based organizations. And so a couple of things have changed. So we know that we get to the root cause of food insecurity and poverty we had to make some changes during the pandemic. One of those was last year we had a pilot program with Safeway, and it was a program that helped us distribute $8 million worth of gift cards. Each gift card had an amount of $50 value. And for us, this was about dignity and choice for our guests. I know that there have been some constraints with food banks because prior to the gift cards, Safeway would fundraise, and whatever was fundraised would then go to that food bank in product. Now it's going in food banks, and or not to food banks, but now it's going in a form of gift cards. But these gift cards are for the clients and not for the food bank to purchase items. We want to be able to give them the ability to be able to walk into a store and buy whatever they need. It might not be food, it might be laundry detergent, it might be diapers or whatever it is they need. And it also gives them the ability to be able to use it for gas. And so that's a huge thing for folks who are experiencing a hardship. And so, and then one of the things that we're doing is, like I mentioned earlier, we're avoiding the push model. We want to make sure that we're giving folks what they need and not necessarily just allocating whatever product we want to get rid of. We've opened up our harvest pantry in all 3 locations that gives other community organizations access to our inventory. We are providing as much as we can more culturally significant or relevant foods for different organizations. And we really have a high emphasis on fresh produce. And so what's next? We are building a 200,000 square feet distribution center in Yakima. We're trying to centralize all of our distribution here to get out of the I-5 corridor, but also to be able to source fresh produce from BIPOC farmers, small farmers, but also to just have the ability to distribute more fresh product to Spokane and to Kent, our distribution centers, in a better way, and also just coming out of our Central Valley area. And so our hunger response network is focusing on, I mentioned earlier, the hiring of a tribal specialist, partner evaluation, and a BIPOC coalition to better understand what are the needs of those communities. And that's it. So I'll stop there. And I don't know if there's a Q&A now or later, but I'll just stop sharing.
Thank you, Carmen. We are holding questions towards the end of this lunch and learn, but thank you for pointing that out. I completely forgot to mention that. It's also wonderful that you have all these curated specialized foods as well for all people of all different walks of life as well. Next up, we have Sophie from UW Food Pantry. Sophie.
Hello. I also have a presentation, so I just share my screen now. Is this working? Okay. Okay. So I'm Sophie Reynolds. I am the current director at the UW Food Pantry here on campus. I've been in this role for about 6 months now. So I'll just talk a little bit about what the pantry does and what needs we're seeing this quarter as we've returned to campus. So this is sort of our mission statement. We serve students, staff, and faculty at UW for no cost. Anybody with a Husky ID is welcome to come in and use our services. We don't require any demonstrated financial need or food insecurity of any kind. And another one of our main goals is to reduce the stigma surrounding food insecurity by providing a welcoming and dignified experience for visitors. We currently use a shopping model. Here's a little bit about food insecurity. I know that this panel is probably more well-versed in it than I am, but this is sort of the definition that we use on our order form and that we tell visitors and potential donors. So some quick estimates about food insecurity on campus. Estimates really range anywhere from 15 to 25% regarding students who might be facing food insecurity. Currently, we're only serving about 250 to 300 visitors a week. So we know that we're definitely not reaching everybody on campus that is experiencing food insecurity, which is kind of the main takeaway from these studies. This one is from 2019. So like I mentioned, we have about 250 visitors a week. Majority are graduate and undergrad students. We do have more graduate students than undergrads, and we have a few staff members that come in regularly. And we also have about 20 parent visitors each week. Like I started to touch on, we use a shopping model in our pantry, so visitors have a point limit of 12 points each week, and parents do get 17 points a week. And so all of our items are assigned point values based on size, serving count, nutritional value, substance of the food item. And so COVID, we've seen a lot of our visitors come in whose, housing situations or food security situations did change in COVID. So this is just a quick snapshot of some of the data we've seen when we've surveyed our visitors about what's brought them to the pantry to sort of understand which factors are most affecting food security on campus. So since the pantry was founded in 2019, we've used this shopping model with the point system. When COVID started, we switched to an online order form that we keep updated with items that we have in stock. Visitors are able to place their orders online, select a time that they'd like to come pick up, and then volunteers will pack baskets like you can see in this top corner, so that when visitors come in, it's a really quick experience for them. We also glean food from the UW farm and from other dining locations on campus. So these are fresh items that would have otherwise gone to waste, but we recover them while they're still safe to eat. And those items are always 0 points, and visitors, it's first come, first serve. So when visitors come in, they can see which ready to eat and fresh food items we have, which produce is still available. And this is just a couple statements from our annual survey that we did in June from visitors, sort of telling us what the pantry means to them. We have a lot of visitors who maybe would be okay without our services. They don't rely on us, and we typically don't give away enough food that it could sustain somebody for an entire week. But it really means a lot to hear about visitors who tell us that they were able to have less stress and do better in their classes, or take off a few hours of work to prepare for an exam or do a project because of what the pantry is providing. It's really hard to be a student, and it's even harder if you have these external factors that are bringing in extra stress. This is an overview of where we get our food. We do purchase food every week from Costco and Amazon and Walmart and a few other vendors, but we rely on donations. As you can see, the blue bar is food that we've donated, and with the return to campus and more food drives, I'm expecting donations to make up a majority of the food that we purchase and gather this year. And then gleaning is food from the UW farm, local point and center table, our dining halls on campus, the UW Medical Center, and we've also been working on forming a new partnership with Starbucks now that the Starbucks locations are open again on campus. So that's been a really exciting project for us this quarter. So here's a more specific breakdown of where we recover food from. And this also includes our food drives. So you can really see that even with all the food that we recover from these on-campus locations, an organization hosting a food drive really makes a huge impact and accounts for a lot of the food that we're able to bring into the pantry. Here are our most popular foods. Proteins and grains and milk are really our most popular categories. But this is just sort of an overview of what our visitors prefer, and so what we try to keep stocked regularly. These are the kind of items that if they weren't donated, we would make sure that we were purchasing them from a vendor to keep them in our pantry regularly. And then this is just it's not an extensive list, but a few things that donations are always appreciated. At the pantry, we can accept anything that is non-perishable, unopened, and preferably non-expired. Then I've also just listed a few ways that you all can support us. We do have an Amazon wish list. I'll put that into the chat. That has some of our staples that we purchase from Amazon. Hosting a food drive is a great way. I think you all have worked with Felicidad, our food drives coordinator, to help organize one. And then we also accept donations in the pantry during our opening hours. And I've put below our current opening hours this fall quarter. Next week, they will look a little different because of the Thanksgiving break. And we're hoping that they will be expanded in the winter quarter. We're hoping to bring a couple more staff members on to help us expand our availability to be open. We also have over 60 volunteers this quarter. We're almost always accepting new volunteers. It's been really great to have so much interest this quarter with students back on campus looking for ways to be involved. And then also spreading the word about the pantry as a resource. As I mentioned before, we can pretty much say with 100% certainty that we're not serving every student that could benefit from our services, just based on national estimates of food insecurity on college campuses. So we're always looking for ways to spread the word about the pantry and reach more visitors. Okay, thank you for listening. Again, I'll hang around till the end in case anybody has specific questions about the pantry and the work that we do.
Thank you, Sophie. Those graphics was really wow for me. It really helped me visualize how you process all the food that comes into your the UW Food Pantry. It's really awesome. Next up, we will be doing Jeremy with the Lifelong. Jeremy, would you like to take it away?
Yes, absolutely.
Yeah, thank you.
Cool. So my name is Jeremy, and I'm the corporate engagement specialist over at Lifelong, and I will go ahead and share my screen. Alrighty, and so Lifelong has been around for nearly 40 years, and we've supported and empowered communities to remove barriers to health. I've got a short video, which is about 2 minutes, and then I'll be able to talk about Lifelong's history and mission, so our impact. Then we'll be talking about our food program, our Chicken Soup Brigade, and then volunteering. And then we'll be open to questions at the end. So let's go on to our video right here.
Lifelong exists to make sure that no one faces illness and injustice alone. When we first started out 35 years ago, folks were facing the AIDS epidemic, and they were facing not only illness, but the injustice that came with it, the stigma, the barriers to care. And so the community came together and not only provided that compassionate and support, but fought for people's rights. And so over time, that model grew and grew, and now we're able to do that same thing with people who have all kinds of different needs all across the state.
Working with Lifelong, I feel like I'm even more ingrained in the community. They had a delivery route here in the Auburn area that I guess they had not been filled for many years. They always had to have their staff do it. So I was like, sign me up, So, and there's a lot of people in this community who are they're on the brink. So it's nice. I think that you're able to help. Sorry. be able to help them out. So yeah, it's good.
Our meals are they're all prepared fresh from scratch here in the kitchen. We find that there is a connection between food and health. And we know that the food that we're providing is incredibly important for people who are living with chronic illnesses. The research shows that when people have nutritious meals, medically tailored meals, their health improves, their readmission rates into the hospital decrease, their visits to the emergency room decrease. We also know that food is a tool of prevention. So if people have access to really nutritious foods, they can live long, healthy lives and may not develop diet-related diseases that so many people in America are experiencing.
As we move into the future with Lifelong, I'm really excited about the work we've done to clarify our mission and to really look at our impact across all of the different areas where we help. I think that's just a huge opportunity for us to expand our impact and be able to better serve the community. And that's what we're going to continue to do, learn from the community about their needs and make sure that we're there alongside them fighting for their right to live a healthy life.
Cool. And now we can get back to the presentation. And so that was just, that was Claire, who's Lifelong CEO. We also heard from James, one of our volunteers, and Dana, who is our...
Book your perfect stay
sorry.
easily in the booking.com app. Take the stress out of booking a vacation. Book now, pay later with free cancellation options plus extra perks with Genius. Only...
I'm sorry about that. Let's get back to the presentation. Yeah, so about our history and legacy. So Lifelong has, our legacy statement is that Lifelong has always fought for people living with HIV, and we always will. So we were started in the mid 80s at the height of the HIV epidemic here in Seattle to provide care and prevention services for folks living with HIV. They were seeing that elected officials and national leaders were displaying unspeakable cruelty and bigotry when they were refusing to support the support services and research needed to combat the early surge of the epidemic. And then in Seattle, a handful of volunteers were witnessing their friends, partners, and neighbors being neglected to die, and they were compelled to fight back. And so the group mobilized the community to fight against injustice. They made a life-saving difference in the lives of thousands through the assembly of chore wheels, hospital visitation calendars, and the establishment of new nonprofit organizations. 3 of those organizations helped create Lifelong today, and our roots are with the Northwest AIDS Foundation, the Chicken Soup Brigade, and the Evergreen Wellness Advocates. We kind of honor the Chicken Soup Brigade today because that's what we call our food program now. And also the Evergreen Wellness Advocates were formed in Bellingham. And so Lifelong, I'm based out of our Seattle office, but Lifelong also has offices in Bellingham, Everett, and Bellevue. So we're really just trying to reach as many folks as we can across Western Washington. Next up is, talking about our vision, mission, and legacy. So our legacy statement I touched on earlier, we've been able to update our mission really just because we've been able to apply our services and expertise for folks living with HIV, but also other disease states. And our vision is that we really can be health for all, really any marginalized person who's falling through the cracks in the healthcare system. So our mission has been updated to remove barriers to health with relentless compassion so that no one faces illness and injustice alone. And yeah. But also making sure that the HIV community is our North Star and that, you know, we will always be there to serve them, and we always will be. So this is just a little bit about what Claire had touched on earlier about our whole person model of care. Everything is intersectional. So like someone who's enrolled in our food program might also be enrolled in housing, but these are just kind of, it's an overview of the 8 programs that Lifelong does have: housing, social support, employment, dental care, care and prevention, healthy environments, access to care and food and nutrition. I'll be focusing on food and nutrition today, just because that's what the focus of this call is. It's also where we are able to engage our volunteers, because our kitchen and our warehouse has been open throughout the entirety of the pandemic. So we'll be able to talk about that more. How Lifelong tackles health inequities. We're really just trying to dismantle systems that are hindering people from living their healthiest lives, and hopefully being able to provide tools so that they can be empowered and learn how to navigate these complex systems, so that whether it's eliminating stigma, creating authentic relationships, we really just want to be there so that we can care for the whole person. This is some of the impact from last year. We were able to serve over 6,000 people over our 8 programs. We were able to provide almost $5 million in rent subsidies. Lifelong believes that housing is a human right. And so it's just pretty vital that we're helping these folks who are enrolled in our housing program find safe and stable housing. We were able to deliver over 300,000 meals to over 2,500 people. And we were able to have over 20,000 hours of volunteer service, and volunteers are vital to who Lifelong is as an organization, and it has a tremendous impact. It helps offset more than $500,000 worth of program costs. And so we're here to talk about Chicken Soup Brigade. And Chicken Soup Brigade, the main tenet of the program is that food confuses medicine, and Chicken Soup Brigade is the only program in the Pacific Northwest that is providing medically tailored meals. Our footprint covers King Island and Snohomish counties. And then who Chicken Soup Brigade serves. So Chicken Soup Brigade is one of our HIV and programs. And so it started serving the HIV community, but the tenet that, that food confuses medicine is applicable to any disease state. And so there are also folks living with diabetes, kidney disease, various types of cancers. There are a lot of homebound seniors who are enrolled in the program, and they're also facing stigma and layered needs, talking about how someone who is enrolled in one of our other programs might also be enrolled in Chicken Soup Brigade. So they might be facing limited housing access, or facing social isolation, or mental health or substance abuse struggles, and then also low income. The primary services that Chicken Soup Brigade offers are our nutrition services, our medically tailored meals, and then our nutritious and culturally tailored grocery bags. The cool thing about Chicken Soup Brigade is when someone's enrolled, they will meet one of our dietitians, and they'll be able to assess what their cultural and dietary needs are. So if something needs to be easier digestion for one of our senior clients, it can be. If something needs to be low sodium for someone living with higher blood pressure, that can also be taken into account as well. And then the kind of working in tandem with our kitchen who's preparing our meals and our warehouse who's preparing our grocery bags is that we have a distribution team of 7 delivery drivers and about 100 delivery volunteers, and they are delivering our meals and groceries directly to our clients' doors. So this is a little bit more about Chicken Soup Brigade's impact, delivering over 300,000 medically tailored meals to our clients, and then also focusing on nutrition as a food bank standard, and helping other programs create medically tailored meals as well. This is just a quick snapshot about what we're doing. So we're providing meals in our kitchen, preparing grocery bags in our warehouse, and then packing up vans so that meals and groceries can go directly to our clients. And then this is just talking about a little bit about volunteering at Lifelong. Last year, we had over 2,000 volunteers serve over 25 hours of service with us. And this is including different groups. So we've had different corporate groups, but also a lot of school and community groups, as well as friends and families. And then the main volunteering opportunities we have in our Georgetown warehouse is helping prepare meals and groceries, and helping package our grocery bags. Right now, the limit is 7 volunteers. We had to reduce that so that our staff and volunteers can stay socially distant. And then we are also requiring all volunteers to be vaccinated to keep our staff and volunteers as safe as we can. Cool. Thank you. And sorry for the YouTube continuation. I apologize for that.
Thank you so much, Jeremy. There was a lot of information in there, and I also sympathize. There's nothing like commercial promising relaxation to unironically hike up my stress levels. All right, I will now move on to questions and closing remarks. And if anybody has any other burning questions, now would be the perfect time to ask them.
Oh, sorry. Hi, I have a question. I want to thank everybody for being here today. It's always so interesting to see how something so basic as food and food distribution is done so differently to meet different populations' needs. What would you say over the course of the pandemic and as we continue to evolve into like what the post-pandemic world is, has been your biggest challenge or the biggest thing you've learned about the clients that you serve? And you guys can decide who, you can all answer that.
Cool. Does anyone want to go first? I can kick it off. Just I know that supply chain has been just a huge issue for both our warehouse and our kitchen, that they've had to make adjustments on certain proteins that they're ordering for the kitchen or certain shelf stable items that they're ordering for the warehouse, just so that things can come in on a timely and also cost effective method. So a lot of recipes have had to been adjusted, and a lot of grocery bag plans have had to have been adjusted. The other thing for us is just our kitchen and warehouse were the programs that stayed open through the entirety of the pandemic. Myself, I mean, I go in now 2 days a week, but case management, housing, insurance, dental, they were all working remotely and meeting their clients telephonically or through Zoom, but we couldn't put a pause on delivering meals. So kitchen and warehouse stayed open through the entirety of the pandemic. And there was an adjustment of volunteer recruitment because we had to adjust our operations to make sure that it was COVID compliant, COVID safe for both staff and volunteers. That during the initial parts of the pandemic, we saw a decrease in our corporate groups, just because a lot of our corporate groups, a lot of our community groups were putting a pause on external work functions. But luckily we were able to find an increase in individual volunteers because people had more time or they wanted to just intentionally set the time aside to give back. So it was a lot of adjustment, both volunteer and supply chain wise.
Jeremy, can I just ask you a quick follow-up question?
Yeah, absolutely.
How did your clients respond? I mean, like, so for many years, my mother-in-law got Meals on Wheels, and she would get really fixated on like, today is macaroni and cheese day.
Yeah.
How did your clients respond to getting meals that maybe they weren't expecting?
Yeah, so one thing that our warehouse programs, our groceries have, for as long as I've been here, and I've been on the team for 8 years, is that we've had culturally tailored grocery bags for our for our Latinx, Asian Pacific Islander, and East African clients. And last year, we also made it a priority to offer those same options for our meals so that people could choose and have different preferences on what they're familiar with. So I know that that's been something that has been fun for them, just because, you know, it's always, I mean, it's for me too, like when you're eating something that you're familiar with, or you're preparing a meal with ingredients that you're familiar with, you're more likely to continue with those routines. And so it's just been something that it was a priority for the kitchen and for the food program to kind of make those specifications. The other thing, just the way that some of our clients, just interaction with our delivery drivers has also been something that was kind of hard during the pandemic, just because for someone who's getting their meals delivered, oftentimes our volunteers or staff were the only people that they were seeing. So just making sure that we could be there with be a friendly face for them. And also just one thing that we do is we have well wish notes, which are just like fun little notes of affirmation that we drop in each meal bag that we're doing twice a month. And so that's a volunteer opportunity that we offer remotely for someone that doesn't want to come in. But yeah.
Excellent. Thank you. I also love that note idea. That's really beautiful. That's like super kind. I love it. All right. Thank you.
I can answer next. We've also had our fair share of supply chain issues, specifically getting some of our canned proteins. Costco's been pretty backed up with those, Spam, canned chicken, some other stuff, toilet paper. For a while was hard because we were only able to order so much because these groups were trying to prevent hoarding. So that was kind of hard to explain that, like, we weren't hoarding, we just really needed, 4 bundles of toilet paper. We've also seen our visitor numbers almost triple since UW returned to campus in the fall. And so we had to sort of reevaluate our whole operation system, the order form, and the way we were prepping baskets and stacking them worked when we had 60, 70, 80 visitors a week. And now we're seeing 250 to 300. And we had to like put up some new shelves and readjust our volunteer shifts to help prepare for that. We've been adjusting well, but definitely the first 5 or 6 weeks of this quarter were pretty intense, figuring out how we were going to stagger ordering and when shipments were going to arrive so that our pantry wasn't cleared out after one day of being open for the week. So definitely just coming out of the pandemic and having everybody back on campus has definitely strained our system a little bit.
Sophie, have you seen a change at all in your client base? Is it primarily students? Are you seeing more faculty and staff, or?
We are seeing some more staff. We're seeing really a little more of everybody. Definitely more undergraduates than previous. My assumption is that maybe there are more undergraduates than graduate students and staff who had gone home for the majority of the pandemic or hadn't been on campus yet at all. And now they're living in the U district and maybe have less families assistance and support. But it's really just been a lot more of everybody since we've returned to campus.
I'll go next. For us, we don't have any clients like UW Food Pantry or Lifelong. We deal directly with food banks and pantries and school programs. For us, like we've had a lot of difficulties with getting the right product, not over ensuring that we're not pushing food, and that's huge for us because food waste is such a huge issue, and so we want to make sure that we're only sending what food banks need. And so keeping that in mind, and there's been a lot of items that typically we haven't been able to get, but then we have an abundance of other items, and so storage has been also a huge issue for us because there's times where we'll get a lot of donated items and we need space. And so, and also figuring out how we can best partner with our food banks. So, yeah.
Does anybody else have any questions they would like to ask?
I have one for Sophie. I was just wondering, when UW closed, were you able to stay open and still serve people living in the U district, or how did that work for the food pantry?
Yeah, definitely. So I've only been around 6 months, so I wasn't here right when COVID hit, but my understanding is that I don't think we closed a single week. We pretty quickly switched to this online order system instead of having visitors come walk through the pantry and shop. We had a pretty strict 5-person capacity limit in the pantry at one time. But at least looking back and talking to the people in these roles before me, I think we were open the entirety of spring, summer 2020, and then we're open the entire 2020-2021 school year.
Sophie, I had a question. You mentioned that you guys have a point system. What does that mean?
Yes, so basically to keep our operation sustainable, we have a cap on the amount of items that a visitor can take. So we use a point system where all our items typically have a point value between 1 and 2 points, depending on the nutritional value of the item, the substance, the amount of servings in a can or a box of whatever we're giving away. And so visitors who are not parents are limited to 12 points each week. They don't roll over or anything, it just resets 12 points. And then visitors who are parents can use 17 points each week. And for a visitor using 12 points, it typically looks like maybe 8 to 10 items from our categories, proteins, grains. We have some baking items, shelf-stable milk, and then visitors can also select produce and ready-to-eat salads and sandwiches that we glean from on-campus locations for 0 points, and they just add them to their basket when they come in, whatever we have available.
And I know that you mentioned that you depend very heavily on donated items and also do a lot of community fundraising. I'll get your info. We're always willing to provide additional canned goods. We have an abundance of them, so anytime. And we know that college students are a population that oftentimes folks kind of forget about. And so we'd be more than happy to be able to provide the pantry with food.
That would be wonderful. I will put my email in the chat. It's really easy. It's just uwpantry@uw.edu.
Right.
And so that's me checking that email. So I'll keep an eye out. Thank you.
Yeah, you're welcome.
These are great questions and great information. Does anybody else have any other questions before I close this lunch and learn very soon? Going once, going twice. All right. Well, thank you all for taking the time out of your schedule to come to our humble little lunch and learn today. Food during a pandemic is no laughing matter, and it is inspiring to see how you all have evolved to continue to serve the community. And I hope that it will continue to serve and we can give back as well. Thanks as well to my fellow campaign assistant Annabelle for getting this all together and getting everybody here today. Now that I'm done monologuing, it's time for you all to get your lunch. So thank you again for coming.
Thank you. Bye.
Thank you.
Thank you for having us.
My pleasure. Let's see.